Hello, hello, Viva Lifers and friends and guests. Thank you so much for being here. I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is through the Viva Life 5. And many of you know we focus on meditation, journaling, exercise, optimizing our nutrition, hormones, and our sleep while we eat the Viva Life 5 foods: fruits, vegetables, nuts, grains, beans, and drinking our water. But even more than that, we offer you different things like this webinar tonight called Ask Dr. Kelly OMD, a podcast 5 days a week. And once a month, we do an affirmation room. So you can literally let it all out so that you can bring all the goodness in. So that being said, we're going to get started tonight. As you know, this is educational purposes only. You need to speak with your own primary care or OBGYN or family medicine physician about your care to figure out what is best for you. I have a special guest here. She is a subject matter expert hailing from the East Coast. Her name is Dr. Ada Stewart, and she is a family medicine doctor that's going to talk to us about HIV and PrEP. Dr. Stewart, take it away and let us know the top 3 things you want us to understand tonight.
Oh my goodness. So thank you so very much for allowing me to have this conversation. I'm here in Columbia, South Carolina, board certified family doc, who also is a specialist in HIV and continues to advocate for women, especially around prevention and PrEP. We think about this conversation. And number one is, why are we having this conversation? Unfortunately, HIV disproportionately impacts certain racial and ethnic minorities, especially Black and brown populations. And then sadly, women as well. 10 times more Black women acquire HIV than whites. And we continue to see those numbers increase. And unfortunately, we are not having that awareness of this wonderful tool that is safe and effective to prevent one from acquiring HIV. HIV can be prevented, and the only way to do so is through PrEP, pre-exposure prophylaxis. And we have this tool, the awareness is not there. And hopefully by the time we finish this conversation, we will be motivated, empowered, and ready to take hold of our sexual health.
We are very excited. I know we're going to get into it, but remember, everyone, we're going to go over a little bit what is HIV and AIDS, because, for many of us, we learned about this in the 70s and 80s, but there's new information that's out there. And we're going to talk about the tools of prevention, not only abstinence and condoms, but this tool called PrEP. So, Dr. Stewart, go ahead, take it away. You have the floor, the field, and it's all yours.
Oh my goodness, thank you so very much. So first of all, what is HIV? So HIV is human immunodeficiency virus. It's a virus that is transmitted through blood, and usually that is through sex or through IV drug use. It cannot be passed through drinking after someone or kissing someone. So some of those old stigmatizing things, have been thrown out the window. It is manageable. It is now a chronic disease. It is no longer a death sentence. Sadly, we still have a lot of stigma surrounding HIV, and that really has driven people to, not really talk about it. And especially when we look at our Black and brown communities. I live in South Carolina, which is the Bible Belt. And so the last thing that you want to talk about is sex and sexual health, as well as, HIV. So one of the other things that we think about is who can acquire HIV and who is at risk. And first of all, I want to say that I do not like the term risk, and now there's some initiatives that are out there that is actually moving away from that term risk, because that's kind of stigmatizing, especially when you talk to women. Are you at increased risk? Yeah, there are individuals who may be more vulnerable to acquiring HIV. Those individuals who have had a STI within the last 6 months, those individuals who may not know the HIV status of their partner, or those individuals who do have a partner that is living with HIV. And so we now have this wonderful tool that is available to us. Pre-exposure prophylaxis, there are different medications, there's pills that you can take one a day. And there's also a new injectable. So there's a new tool on our tool belt that we can use. That injectable is actually an injection every 2 months, which is great for those individuals who cannot take a pill every day. So we have the tools, we have the ways to prevent individuals from HIV. And I really want to mention that when we talk about prevention, we are talking about something that is a public health issue. We are talking about something that is a health equity issue, as well as a social justice issue. So it's important that we talk about what is HIV, how we can decrease the risk, and how we can decrease the impact that we are having in our communities on those individuals who are acquiring HIV.
Absolutely. Thank you so much for that introduction of what we're talking about and why. So you mentioned some of the stats that are affecting us, and could you kind of go over some of the stats again and why does it affect the
Yeah.
Black female population more?
Sadly, when we think about HIV, think about what we used to hear. It used to impact more men who have sex with men. And yes, those numbers still continue to rise. But when we look at, Black men who have sex with men, Hispanic, and then white, right up underneath that is Black women. And usually they acquire HIV via heterosexual contact. And so that's something that a lot of times we don't talk enough about. Unfortunately, those numbers, we still have about 1.2 million individuals who are eligible for PrEP, for pre-exposure prophylaxis, but those numbers are only, we're just kind of getting to about 30% of those individuals who are actually prescribed PrEP. And when we talk about women, sadly, Black women are 10 times more likely to acquire HIV than white women. And so we really have to look at the individuals who are more at risk and make sure that we're targeting them and make sure that we're getting to those individuals so that they're knowledgeable and that they know what tools are out there for them to decrease their risk.
So just to kind of back up on that, you mentioned that the number one, I don't want to say person, but men having sex with men are the most likely to get HIV. Then under that is Black women. Now, is it because Black women are having sex with men and they don't know that those men are having sex with men, or however the male got it, he or she doesn't know how they got it, and then they're having sex and they're not getting tested?
So, this is something that is important. And so thank you so much for bringing that up. This is multifactorial. When we think about, why are Black women more at risk? Number one is many experience intimate partner violence. And so therefore don't have the opportunity to have that opportunity to say that, you need to use condoms, or, we keep those biases that are out there, implicit biases on the part of clinicians, not being able to ask, a woman, whether they are having unprotected sex or not. Looking at them, only focusing on those individuals who may feel that are more at risk in a relationship where they have multiple partners. But remember, it just takes one partner to acquire HIV. We as Black women especially have competing and many priorities, taking care of everybody else except for ourselves. So many times we're not end up getting tested and getting screened. You got to get screened first to see whether, you either have HIV, or if you're negative, then you need to be able to get PrEP. And so not being able to get to the doctor is a big barrier, having to work and not being able to get time off, not having insurance, poverty, especially in our African American communities. And then let's not forget distrust, mistrust of the healthcare system. We are seeing that from the past as well as from like right now. Many individuals experience bad outcomes when they go try to get care. And so we have so many different barriers that impact our population, especially our women, as far as just getting screened and getting to the physician, or now we have other providers who are able to prescribe PrEP, and just having those conversations around sexual health is we have to have those conversations first before we even know whether one is at risk or one is more vulnerable to acquiring HIV, and so therefore need to be prescribed PrEP.
And it's so interesting. Thank you so much for that response. It's so interesting because, as I mentioned, I've just retired from the military, and we get an HIV test every single year. Like it is just clockwork. You get your whole health,
still in the military.
Your whole health, review, and there's certain things you're just going to get done every single year. And so that is true. A lot of people don't talk about it. They don't think about it. Once you hit a certain age, you got to get your mammogram every 1 to 2 years. You know that you should be getting diabetes screening. And some people don't know that they should be getting diabetes screening depending on their age as well. People know about immunizations, but people don't really, like you said, talk about HIV as well as hepatitis, getting those screenings done. And also people think, well, I'm not having sex, or I haven't had sex in a long time, or I've only had sex one time with this person, so I'm not going to go ahead and get screened or tested. And like you mentioned, not having insurance. The question I have for that is, does this come under preventive healthcare? Like, when you don't have insurance, you can go to Planned Parenthood or some other of the FHCQs, and your preventive healthcare can be covered or at a reduced price. So does HIV testing come under that?
Yes, it does. And thank you, because the USPSTF recommends screening as well as HIV for individuals, either 13 or 15, depending on whether you're talking about the USPSTF or the CDC. So the screening we are still falling behind as far as getting individuals screened, but you have to get somewhere first to be able to get screened. So if you don't have a primary care, if you don't have a GYN, if you just don't have that knowledge or that ability to get somewhere, then you don't get screened. And so to even be eligible for PrEP, you have to have that negative HIV test. So you have to have, realize the importance of screening. That is part of prevention. It is covered from all insurances without any copays to the individuals. So yes, it is part of screening, and is a very important part of prevention that we just don't take enough advantage of.
So that brings up another good. And Viva Lifers, please start loading up your questions. I know y'all have them, so go ahead and start loading them up in the chat, and we'll get to your questions as well. PrEP. So we've talked about PrEP a lot. So pre-exposure prophylaxis. And you're telling me that, and in the word it says, before you have contracted HIV or before you get diagnosed with HIV, then we want you to take this medication. So I am a sexually active woman who has one or more partners. Why would I take PrEP?
And it's all about your sexual health and making sure. And when I talk to my patients, I tell them that, if you're having unprotected sex, this is a way for you to take control control of your body. It's your body, I said, your body, your temple, and you take control of your body and make sure that you do not, it's part of the health of your your sexual, and it's something that, we get our pap smears. We always want to, make sure we check down there. But this, of course, is, something that we need to make sure that we think about in ensuring that we maintain a negative HIV test. And so even if you're having one partner, again, if you don't know their status, if they're HIV positive, this is another way to protect yourself. Don't want to forget that if one is undetectable as far as HIV, then they are untransmissible. But again, that's that day. If someone is undetectable today, but then they, don't take their medications and they fall out of care, this again is a way to protect yourself from acquiring HIV.
Okay, so you think about it, and a lot of people are like, well, I'm just not having sex, or I'm not having sex right now, so take that. So, what are some of the side effects? Because I know everybody wants to know, you're taking a medication to prevent, but with every medication, there's always side effects. So, what are some of the side effects that you see associated with PrEP?
Yes, so, we have two different medications, well, two classes of medications. We have the pills, and then, of course, we have a new injection. With the pills, I always tell individuals that start up, you may have a headache, may feel some nausea. Usually that goes away. I call it that startup syndrome. And usually when you start any medication, you may feel some differences within your body. And so that tends to go away after, about a week or two. And so those are things that you may see with the pills. Now with the injection, because it is going into that muscle, I say your backside may be a little bit sore. And so with that, usually you find that, people, when they're aware of the side effects, and then I talk about those things that may go on. We monitor your kidneys, we monitor your liver, make sure that everything stays okay, because with the medication, that the pills that we have for women, they can potentially impact the kidneys as well as the bone. And so those are things that we have to make sure that we follow up. And that's why it's important to not only realize that this medication is important, is safe, and is effective, but you still need that follow-up. And we still need to ensure that you maintain your negative status while you're taking the medication.
All right, so you would have follow up every what, 6 months, 12 months, or?
So usually it's every 3 months. For myself within my clinic, I have a great team. We check in usually with patients after about a couple weeks, just to make sure that they're not having any side effects that are bothersome to them, and that they're okay taking the medication. After that, it's usually every 3 months. And even further than that, if they're doing well, if they're real healthy, we can follow them up every 6 months. I understand that patients and people are busy. They have busy lives. The important thing to note with the injection, you have to get lab work with every injection every 2 months to make sure that you continue to be negative, and that requires blood work. But those are things that, it's great to have that relationship with your, whether it be NP, PA, MD, GYN, family medicine, internal medicine. It's great to have that physician-patient relationship, so that if you have any problems, and recognizing too that when we talk about women, that there is no interaction with hormones, so you can still be on birth control. There's no issue as far as conception is concerned as well, but it's important to have that conversation with your clinician if you are, looking to conceive. For individuals who may have a partner who is HIV positive, what a perfect way to ensure that you maintain your negative status while trying to conceive, of course. And so those are things that are really important, especially when we look at women and recognizing how Yeah, there's effects, but if you're aware of those things ahead of time, when they do occur, you know that this is a normal reaction, and you're not, concerned and say, oh, I'm not going to take this medication anymore. But those are things that I discuss and should be discussed when one is looking to begin.
Thank you, thank you, thank you. So we do have a question here, but it just came into my mind. It's like, if you want to prevent pregnancy, you take contraception. If you want to prevent cancer, you do the screenings and you do whatever it takes to prevent that cancer. So same thing with HIV. If you want to prevent HIV, then you take the PrEP and wear condoms so that you can prevent HIV. So that just came to me. I'm like, oh, in the clinic, what would I say to a person? How do I get this conversation going and started? So we have a question. Is there a stigma around taking PrEP? And how does that contribute to providers not educating patients and prescribing?
Oh my goodness. Great question. And yes, there is. Sadly, there's stigma around HIV in itself. And then there's stigma around, and, certain people are called, are said to be more promiscuous if they're on PrEP. There's been terms called the PrEP whore, and, because one is on PrEP, that means that they're just, having unprotected sex and just out there. But, realize, and that's one reason why I think it's really important to realize that other tool that we have in our tool belt, the injection. That takes away a lot of that stigma, because no one has to know that you're on PrEP. People are nosy. You may have a guest come to your house and looking in your cabinet in your bathroom, and they say, oh, what is that? And people look stuff up, and, they may say that, oh, this person has HIV, but again, because this is a medicine that is used for HIV, but in this instance is used for prevention, is part of the regimen for HIV, but, one part of this is used for prevention. So it's great. We now have something that can kind of that stigma that is out there surrounding being on PrEP, because no one has to know that one is on it, because they go to the clinics to get their shots. Is not an injection that one will have at home. You have to go into a facility to get your injections. And so that really has helped. But yes, there is stigma. Hopefully, as we have more conversations, that will be removed.
Just like we're doing here in Viva Life. And that's why this is going on YouTube, so we can make sure the word is spread as far as possible. All right, there was a question about insurance coverage. Is this covered by your insurance?
For the part, 90% of insurances cover some form of PrEP. Now, we have a little bit more difficulty with the injections. Some insurances don't cover it right off. They will say if you have tried the other medication, the pill form, and had some issue with it, we have to do a prior authorization. So a little bit more work to be able to get the injection. But, because again, this is something that is recommended from the USPSTF, we have the recommendations to screen and to encourage individuals to get on PrEP. It is covered, and so we just may have to do a little bit of extra work to get the injection, but the pills are, pretty much covered. And for those individuals who have no insurance, there's usually some type of program through the drug companies to cover it. And so there is no reason why one should not be able to get PrEP if they want it. And that's another thing I want to make sure that I mention. We don't do enough of as clinicians, because of our biases that we have. If someone comes up in saying that they want to be on PrEP, and this is something that came through from the CDC. If someone asks for PrEP, then we need to prescribe it, and not put in our own biases and say, oh, no, I don't think you need that. Why are you asking for this? Don't ask the question. If someone wants to, if they're inquiring about it, there's a reason why. And so it's important for us to go ahead and prescribe it, because they may not feel comfortable with divulging all their reasons for wanting to be on PrEP.
And that's so important that we take ourselves and our judgments out of the situation. If they have the courage to step forward and say, you know what, I need this, then we need to advocate and empower them to be able to get it, or help them unleash their power is the new thing that I'm saying, help them unleash their power. So thank you, thank you, thank you. And if nobody else has any questions, I want to say thank you so much. I learned a lot tonight. This is not a subject that we talk about a lot in obstetrics, especially in the population that I've taken care of, because everybody gets HIV tests, and then as soon as something goes positive, then we send them over to this. But this has given me another tool in the toolbox to say, you know what, if you want to prevent pregnancy, if you want to prevent HIV, and you want to prevent this or that, then these are the things that you need to do. So thank you so much. I hope that everybody actually shares this with people that they love, people that they know, people that they don't know, because if I didn't know, then you probably didn't either. So thank you, Dr. Stewart. And how is it that we can get more information about this? Or do you recommend any particular websites or information? And if we wanted to come see you as our family medicine physician, how do we do that?
Yes, so you can find any information out through the CDC. They have a huge website that just focuses on women, really recognizing that unfortunately women have been left behind so many times when we talk about prevention and advertising and research, and things are getting better. You may see a commercial on television talking about, women and prescribing PrEP, and making sure that we know that PrEP is not just for men, it's for women. But I'm also on Twitter, and it's at Ada Stewart MD 1, or you can look me up in Columbia, South Carolina, and reach out to me at Waverly Family Practice. And I am so honored and privileged to be able to be here this evening and to talk about this very important topic that is near and dear to my heart, because we really need to empower our women and making sure that they realize that they need to take control of their health.
Absolutely. Thank you. Thank you. Thank you. Thank you, everyone, for coming. Please follow us on Viva Life Health Hub on all your social media channels, as well as at Dr. Kelly OMD. We truly appreciate you. Share this wide and far, and have a wonderful evening. And don't forget to duet. Viva Life. All right, all right. Thank you, thank you, thank you for being a part of the Viva Life Experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please, please, please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.